If you've ever Googled a health article or scrolled through a wellness post online, you've probably seen the term metabolic syndrome pop up. It sounds serious, maybe even a bit scary, but what is it really? And more importantly, does it apply to you? I'm Neris, I'm a GP and founder of the Lifestyle Clinic, and my mission is to help you get the root of your health problems by focusing on lifestyle medicine. In this video, I'm going to break down what metabolic syndrome actually means in plain English. We'll look at the 5 main signs doctors use to spot it, why it's more common than you might think, and it's not just about weight or age, how it's linked to diabetes, heart disease, and many more, and why understanding it can help you take back control of your health without fear or overwhelm. And by the end, you'll know exactly what steps you can take if you're at risk. So let's get started. So maybe you've stumbled across the term metabolic syndrome while Googling symptoms, reading a health article, or scrolling through social media. It is possible that your doctor mentioned it during a routine checkup, or you saw it written on a printout of your health problems and thought, is this something I should be worried about? However you've come across it, you might be wondering what it is. And does it actually matter? And as a doctor, I can tell you that yes, it does. And here's why I care and why you should care about it too. So metabolic syndrome is actually a cluster of symptoms. It's like a flashing warning light on your health dashboard, if you like. It's a sign that your body might be working overtime to keep things in balance, and that if nothing changes, you're at much higher risk of serious problems down the line. So we're talking about type 2 diabetes, heart disease, strokes, and fatty liver. The tricky part is that you might feel absolutely fine right now. There's often no pain, no dramatic symptoms, because it's a slow, silent shift in your body's chemistry. But it is worth knowing about, because if you know about metabolic syndrome early, you've got a real opportunity to make changes. And they're often small, manageable ones that can completely change your future. So what exactly is metabolic syndrome? Well, let's keep it simple. It isn't a disease in itself. It is a group or cluster of health conditions that tend to show up together. And when they do, it means your body's metabolism, so the way you handle energy, sugar, fat, is under stress. As doctors, we look for 5 main signs. The first is a bigger waist measurement. This means carrying extra weight around your middle, even if your weight is normal elsewhere. This isn't about body shaming. Research shows that fat stored around your organs, so the apple shape, is more likely to cause problems than fat on your hips or thighs. For most people, a waist measurement of over 94 centimetres, or 37 inches for men, or 80 centimetres, about 31.5 inches for women, is classed as higher risk. Number 2, high blood pressure. This one often surprises people. Even if you feel fine or your blood pressure is controlled with medication, it still counts. And it's because it puts extra strain on your heart and blood vessels. It quietly raises your risks of heart attacks over time. The third is high blood glucose. So diabetes, even pre-diabetes, or something we call impaired fasting glucose, matters. It means your body is struggling to keep blood glucose in check, even if you haven't quite crossed the line into type 2 diabetes yet. The fourth is high triglycerides. Triglycerides is one of the cholesterol blood tests. High levels can build up silently, increasing your risk of heart disease and fatty liver. Many people don't know their triglyceride levels unless they've had a full cholesterol panel done. And the fifth is a low HDL cholesterol. Now this is the good cholesterol. It helps clear out all the bad stuff from your blood vessels, if you like. If your HDL is low, your body isn't doing this job as well as it could, which again adds to your risk. So if you've got 3 or more of these 5, you meet the criteria for metabolic syndrome. But even having 1 or 2 is a sign your body could use some more support. So you might be wondering, why do these things, blood pressure, blood glucose, cholesterol, waist size, all seem to go hand in hand? And that is a good question. And the answer isn't as simple as a lot of bad luck. At the root of metabolic syndrome is something called insulin resistance. This means that your body cells aren't responding as well to insulin, a hormone that helps move sugar out of your blood and into your cells for energy. When your cells become resistant, your body has to make more and more insulin just to keep your blood glucose in check. And over time, this can lead to higher blood glucose, higher blood pressure, and changes in the way your body handles fat. But insulin resistance isn't just about food or your weight, because genetics play a big role. Some people are simply more prone to it, even if you're not particularly overweight. Stress, poor sleep, certain medication, Hormonal changes like the menopause can all make insulin resistance worse. And yes, carrying extra weight around the middle does undoubtedly increase your risk, but it's not the only factor. So if you see yourself in these risk factors, please know this is your body's way of telling you it needs a bit more support. And the good news is insulin resistance and metabolic syndrome can often be improved, sometimes dramatically, through small, sustainable changes. So next, let's talk about what we can actually do to support the body, lower the risk, and to feel better without crash diets or punishing routine. So here's something important to know right from the start. Because metabolic syndrome is a cluster of different risk factors, there isn't a single magic bullet or quick fix. No one pill will cure it overnight. But the good news is that small, steady changes in a few areas of your life can really add up and make a big impact, sometimes even more than you'd expect. So let's start with food. You don't need a fancy diet. Tweaks: add in more vegetables, prioritizing protein, cutting back on sugary drinks or these ultra-processed foods can help your body respond better to insulin and lower your blood glucose, blood pressure, and triglycerides all in one go. Move your body your way. You don't have to join a gym or run marathons. Even a daily walk, gentle stretching, dancing in your kitchen can help your cells become more sensitive to insulin and reduce those risk factors. The next is to prioritize sleep and stress management. Poor sleep and chronic stress can make insulin resistance worse. Try to build in small moments of rest, whether that's reading, gardening, meditation, or just simply sitting down. Let's talk about something that's often overlooked, which is your waist measurement. I know it's easy to get caught up in the numbers on the scales, but when it comes to metabolic syndrome, where you carry your weight is often more important than how much you weigh overall. Carrying extra weight around your middle, what we call central or visceral fat, is a much stronger signal that your body is under metabolic stress, because this type of fat sits deep inside around your organs and is closely linked to insulin resistance and the high blood pressure, raised blood sugar, and all of it. That's why doctors pay more attention to waist circumference, not just BMI or total weight. And in my experience of running diabetes remission clinics, I've seen time and time again that people can lose several inches around their waist without seeing a huge change on the scales. And that can be frustrating if you're just tracking your weight. But those missing inches are a powerful sign that you're losing visceral fat, that dangerous fat that drives metabolic syndrome. In fact, I found that people often say more motivated when they focus on waist measurements rather than their weight, because it's a much clearer sign that the body is healing in the right way. So if you're on this journey and the scales aren't moving much, don't lose heart. Grab a tape measure, check your waist every few weeks. If you're losing inches, you're making real, meaningful progress, often long before the numbers on the scales catch up. Now then, if you'd like more support, I've created free resources with practical tips and simple steps to help you get started on managing insulin resistance and decrease metabolic syndrome. This is a 3-part video series specifically helped to unlock insulin resistance and to help you understand more, to make meaningful changes to get control back of your health. So I'll see you inside there. Thank you.